it's Dr. Hillary. I thought I'd pop on here live today and talk about one of my favorite topics. It's a therapy that we do in the office, lovingly called cupping. If you have any questions, feel free to comment them below and I will see them pop up on my end and I can answer any more specific or detailed questions. So cupping are those little like plastic or glass cups. They're round and sometimes they're big, sometimes they're really little. You can use them with fire. So fire cupping is a little scary for me. So we use plastic ones in the office that use like a suction pump, or I have ones that I can like manually like pump down and like kind of like suck up the muscle. So what it does is I'll use my hand as an example. I put the cup on the back and it like pulls the muscle up into here. And then what cupping does is it increases blood flow in the area. It also can like break up like adhesions. So if someone has like overused area, overworked, like even just for like posture and upper back, I feel like we do a ton of cupping up there, especially in the past like year and a half. Hashtag thanks COVID. So it gets more blood circulation. That's going to loosen up the muscles, because when the muscles are like tight, we've got like stagnation and not enough like blood flow. We also have a buildup of toxins, and toxins could be like lactic acid just from like overuse and abuse type of thing. So it reduces the toxins, reduces like the amount of tension. The other place I love to do that is on the low back. I love that. And it just kind of, you just lay there for about 10 minutes. That's what we do in our office. Times vary, I'm sure, where you go. And you can have anywhere from like 4 to 15 cups on you, depending on like where we had to do it. So if we had to do the lower back, I like to at least get 6 lower on the lower back minimum. Same with the upper back. Some people need more or less. I have done it on kids. I've done my own kids, like when they have like a cough and you can just like kind of hear it rattling. I cup like over the lung fields in the back, and it is amazing, even every time I do it to myself or my kids or to my patients, how much it can loosen up like congestion in the lung fields, and how like you can just like cough out any like mucus or stuff. It's so crazy to me, and it's so crazy that it works so well on kids too. So instead of putting them on medication that maybe is not going to help, we can just like break up the mucus and allow the body to heal itself naturally. So that's why we do a lot of these therapies, is just more natural healing approach. And again, it's not for everyone. So it depends like case by case, who we do it on, where we do it, and we talk about it. So in the office, we generally do the cupping after adjustments, because I like to adjust, and then I like to loosen up the muscles so the adjustment that I did like stays in place and has its best possible advantage to staying in alignment, and rather than being so tight where everything like shifts back out of place. We do have patients that come in on opposite weeks for cupping. So lately we've had a stream of patients that will, let's say, get adjusted one week, and then they want to come in the next week just for cupping, and they kind of rotate like that. So that's fine. I don't care. The main thing is to get the muscle tension and tightness under control, increase the blood flow, that we don't have a lot of constrictions. I was going to mention that cupping is actually from China. In fact, one of the articles I read that they think it could be even as far back as the Egyptians. So I find that really cool. I love all that kind of stuff, like knowing where things came from and the origins. Even though I feel like in the US, when I first, like, honestly, I knew about it for a while just from going to chiropractic school. But when the public first started noticing it, remember when Michael Phelps was the swimmer and he had all those like circular marks on his back and he looked like he was attacked by an octopus, and everyone's like, what's he doing? So a lot of athletes use the cupping, and non-athletes like myself, just, poor posture type people. We have a lot of like parents in our office that need it. We've done cupping on legs, arms, but I would say the majority of people like it on their back. So that being said, we can do cupping if you're a patient here at the office. If you're not a patient, you can just call and ask to come in for a cupping session. Most people need more than one. I'm just going to throw that out there because it seems like most of the people that come into my office are super tight. I feel like sometimes you don't realize how tight you are until it's really bad. And I know that personally too. So I find that often is that people are a lot tighter than they think. We do have a new patient special going on this month. With our new patients that come into the office, we're giving them a free cupping session. So that's a value of $25. So if you're thinking about coming in for cupping, great. If you're thinking about, now's the time to do some chiropractic care too and really fix like the root cause of everything, we can do it all at once. And visits here at our office take maybe like 5 minutes for an adjustment and about 10-ish minutes for cupping, depending on how long it takes us to apply all the cups. So hope you learned a little bit about cupping. Ask me about it when you're in next time. Follow us on Facebook and YouTube and Instagram, and we post pictures of doing different things on there. I would say the most pictures we post are on Instagram. It's just at Rangeline Chiropractic. Thanks for watching. Have a beautiful day.